the brain, and then we'll get on with the spinal cord, the last part of the central nervous system. So we've talked about the brain, what it does, all the regions of the brain, and now let's talk about the ways in which our brain is protected, starting with the meninges. The meninges are going to cover and protect the entire central nervous system, not just the brain. They protect the blood vessels and enclose the venous sinuses. They contain cerebral spinal fluid, and they form partitions within the skull. Meninges are made up of 3 layers going from outside to in. We have the dura mater, the arachnoid mater, and the pia mater. So we start really protecting with bone structures, and before that we have skin. The skin over the bone, then under the bone is the meninges begin. The strongest of them is the dura mater, which literally means tough mother. It's made up of 2 layers of fibrous connective tissue. Periosteal layer is going to attach to the inside surface of the skull. Osteal should make you think bone. It's found only in the brain, not in the spinal cord. The meningeal layer is the true external covering of the brain. It extends into the vertebral canal as spinal dura mater. The 2 layers are mostly fused together, but there are places where they separate from one another, and those structures are known as the dural venous sinuses. And sinuses collect venous blood from the brain and empty it back into jugular veins of the neck. Dura mater extends inward in several areas and forms flat partitions that divide the cranial cavity. They are referred to as the dural septa. They act to limit excessive brain movement. 3 major ones are the falx cerebri, the falx cerebelli, and the tentorium cerebelli. The falx cerebri is in the longitudinal fissure and attaches to the crista galli. The falx cerebelli is along the vermis of the cerebellum, and the tentorium cerebelli is the horizontal dural fold over the cerebellum and in the transverse fissure. And this is an image of a dissected brain. You can see the dura mater still on this side, missing from this side. Below that is the arachnoid mater, which literally translates to spider mother. It's the middle layer, and it's called that because it has spider web-like extensions. It's separated from the dura mater by the subdural space. The subarachnoid space has cerebral spinal fluid in it and the largest blood vessels of the brain. The arachnoid granulations protrude through the dura mater into the superior sagittal sinuses, and that helps for the reabsorption of cerebral spinal fluid back into venous blood. Here is our subarachnoid space. Above it, the subdural space. The pia mater literally means the delicate mother, is a delicate connective tissue that clings tightly to the brain, follows all the convolutions, goes up with the gyri, down with the sulci, has a lot of tiny blood vessels, and those blood vessels are providing nutrients to the brain. Meningitis is an inflammation of these meninges that may spread to the central nervous system, which would lead to inflammation of the brain itself, and at that point that would become encephalitis. Meningitis is usually diagnosed by observing the microbes in samples of cerebral spinal fluid, but we don't have to stick the needle in the brain to get that cerebral spinal fluid. Because it circulates throughout the central nervous system, we can get it from the lumbar region of the back using what is known as a lumbar puncture or a spinal tap. Cerebral spinal fluid cushions and keeps a constant volume around the brain. It's part of the protective nature of the brain itself. It gives buoyancy to the central nervous system so that your brain and spinal cord are really floating in there. Reduces the weight of the brain by 97% so it doesn't get crushed under its own weight. Protects the central nervous system from blows and other trauma, and also nourishes the brain and helps to carry chemical signals, distribute chemical signals. It's a watery solution created from blood plasma, but there are less proteins and a different ion concentration than you find in plasma. The choroid plexus is a cluster of capillaries that hangs from the roof of each ventricle. It's enclosed by pia mater, surrounding layers of epidermal cells. The cerebrospinal fluid is going to be filtered from the plexus at a constant rate. Epidermal cells are going to use ion pumps to control the chemical composition of cerebrospinal fluid and help get rid of waste from the cerebrospinal fluid. The cilia of the epidermal cells help to keep the cerebrospinal fluid moving, circulating. And in a normal adult, it's a volume of about 150 milliliters is replaced every 8 hours. So it's circulating through those ventricles all the way up, down, around, and in. Formed through the action of choroid plexus and the epidermal cells. Hydrocephalus is an obstruction that blocks cerebral spinal drainage, circulation or drainage, and that increases pressure. In a newborn, you can accommodate that pressure because the skull bones are not fused, so the head will enlarge, almost like blowing up a balloon. Adults do not have that ability. The skull is locked in place. Any pressure that builds up within is going to be exerted on the brain tissue itself. It can compress blood vessels, soft nerve tissue damage, and cause brain damage. In order to drain the cerebrospinal fluid, a shunt is put in that takes that fluid to the abdominal cavity. And this, unfortunately, is an example of hydrocephalus in a newborn. That fluid fills that space and needs to be drained. Another protective feature of the brain is the blood-brain barrier, which helps maintain that stable environment of the brain. The chemical variations that normally occur in plasma cannot be tolerated by neurons. So we need to have a barrier between the plasma and the brain. Its substances from the blood have to go through continuous epithelial capillary walls before they get into the neurons. There are tight junctions that ensure substances pass through and not around the endothelial cells. So these are the tightest capillaries we have. The feet of astrocytes and smooth muscle-like parasites are going to surround those epithelial cells, and that helps to promote the tight junction formation within the endothelial cells. A couple of ways to move through there. Simple diffusion. If it's a lipid-soluble substance, and blood gases will do this, they can pass freely through the cell membranes down their concentration gradients. There can be specific transport mechanisms. Facilitated diffusion could move things that are in the correct concentration gradient but cannot cross the membranes on their own. And that will be taken care of for glucose, amino acids, a few specific ions. Anything bigger than that, you're going to have to use transcytosis. You're going to have to pick it up on one side of the cell membrane, take it across the cell, and dump it out on the other side of the cell. So where most capillaries have gaps between the cells, there are no gaps, or the gaps are filled in the blood-brain capillaries, and they are also backed up by the feet of astrocytes. Thick basement membrane surrounds the capillaries. It's the last part of the barrier substance have to get through. Within that membrane, there are enzymes that destroy certain chemicals that would activate brain neurons. In some areas, the blood-brain barrier is not present. The vomiting center and the hypothalamus, those need direct connections so that they can monitor the chemical composition or temperature of the blood. So we're going to wrap it up with things that can go wrong in the brain. An important one for you to be aware of is traumatic brain injuries. Traumatic brain injuries can include concussions, contusions, subdural, subarachnoid hemorrhages, or cerebral edema. Concussion is a temporary alteration in function, although we know they are, and it's becoming more and more clear, an additive injuries. Contusions can lead to permanent damage. Hemorrhages can change pressure and force the brain to move into places push it into places it should not be. And edema is swelling but not caused by blood. A cerebral vascular accident is also called a stroke. It's caused by ischemia. If the tissue is deprived of oxygen, then it is said to be ischemic. It can be caused by a blockage of the cerebral artery or by a blood clot. Glutamate would act as an excitotoxin, and that worsens the condition. Often results in hemiplegia, which is paralysis on one side. Sensory or speech deficits may also result. Remember that it is a contralateral organ, so the damage to one side of the brain is going to cause, in general, injury on the other side of the body. Before many strokes, there are things called transient ischemic attacks, which are temporary episodes that are reversible cerebral ischemia. And they are indications that you are at higher risk for having a true stroke and should not be ignored. There is one approved treatment for strokes. It is called tissue plasminogen activator. It is a clot buster. And if the stroke is caused by a clot that is blocking blood vessels, TPA can help if it's given quickly. If it is not caused by a clot, TPA is not going to help. There are a number of degenerative brain disorders. Probably the most feared of these would be Alzheimer's disease. It's a progressive degenerative disease of the brain that results ultimately in dementia and death. We don't really understand all the pathology of Alzheimer's yet. We don't fully understand the causes of Alzheimer's, but we do know there are some things we can see in the brains of Alzheimer patients. The key proteins are misfolded and malfunction, leading to memory loss, shortening of the attention span, disorientation. Eventually, language is lost. Patients become very irritable, moody, confused, and may have hallucinations. There are plaques we find in the brain called beta amyloid, and there are also tangles of within neurons called neurofibrillary tangles that may be interfering with transport mechanisms. And as the brain dies, the brain does shrink. So we have a normal brain here, functional MRI versus a functional MRI of an Alzheimer's patient, and you can also see that morphologically this is changed along these sides. Parkinson's disease is a degeneration of dopamine releasing neurons in the region we call the substantia nigra. The basal nuclei, when they don't have dopamine, become overactive, and that leads to resting tremors. That is a hallmark of Parkinson's disease. Again, we don't really know the cause. There are lots of theories out there. Mitochondrial abnormalities may be, protein degradation pathways might be. Parkinson's disease can be treated with L-DOPA, which is a form, a precursor to dopamine that can cross the blood-brain barrier. There is also work using deep brain stimulation and perhaps gene therapy at some point. Stem cells may give the key to Parkinson's. Excuse me, dusty down here. Another one is Huntington's disease. Huntington's, we do know what's caused it. It's a fatal hereditary disorder. And the ultimate cause is the accumulation of a protein called huntingtin in the brain cells, which leads to degeneration starting in the basal nuclei and then the cerebral cortex. The initial symptoms are wild, jerky, flappy movements. Later on, it's marked with mental deterioration and usually becomes fatal within 15 years of onset. Some of the symptoms can be treated with drugs that block dopamine's effect. Some stem cell implant research may show some hope, but in general, it is not a very good prognosis. So to diagnose or assess dysfunction in the central nervous system. We can use a number of different tests. Knee-jerk reflex gives you an idea of the responsiveness of a simple neural circuit, and abnormal responses there could include intracranial hemorrhaging, multiple sclerosis, hydrocephalus. We also have CAT scans, MRIs, and PET scans to allow for the identification of tumors, lesions, plaques, areas of lacking oxygen, damage from infarct. And then we can use radioactive tracers to help visualize specific areas. Cerebral angiography is going to use an X-ray with dyes to pinpoint where strokes are causing clots or blocks. An ultrasound can be used to evaluate blood flow through the arteries feeding the brain.